You're watching Life Network, an Alliance Atlantis network.
Hi, I'm Deborah Kelly. Welcome to Diagnosis MD. Today's topics are tattoos, piercings, and splitting, winter itch, laser resurfacing, moles, and teenage acne. Joining us today are Dr. Daniel Schachter, a dermatologist, Dr. Lisa Kellett, a dermatologist, and Dr. Martie Gidon, also a dermatologist. Our first topic today is tattoos, piercings, and splittings. 69% of pierced teens are girls, while girls who are tattooed make up 61% of the teen population. 82% of the over 1,500 Canadians polled by Leger Marketing said they have no tattoos or piercings on their bodies. Improperly administered tattoos and piercings can be a source of life-threatening illnesses such as hepatitis B, hepatitis C, HIV, and a host of other bacterial and viral infections. Martie, you know, it just seems nowadays that, you know, little girls getting their ears pierced just isn't enough.
True, but it's a cultural thing. It's a way of showing individuality, and whatever someone decides to do, you have to make sure that you go to someone who, first of all, knows what they're doing and that they are using sterile technique, because infections really do occur, and it's very important to protect yourself from these things.
And of course, but things like, Lisa, like splitting, I mean, that's very dangerous, and there must be lisping, all kinds of problems involved.
In fact, there have been some problems with infection and even bleeding, which can actually cause death if you're allowed to hemorrhage.
And, you know, as Martie said, you know, everything moves in trends, and, you know, a pierced belly button or pierced areas can be very complimentary. But sometimes it seems, Daniel, that it's almost going to an extreme, you know, pierced nipples, pierced penises.
I think that piercing and tattooing have now almost become mainstream, and they're very widely accepted. And I think that some people pierce one thing, some people pierce many organs. I think that there are some sensitive areas, as you mentioned, where they can get into trouble with infections or tearing. You have to be careful with piercings that the pierced area doesn't get torn.
Scarring has become a problem as well, where thickened scars or keloids can develop, especially the navel piercings, even on the earlobes, but on the upper ear into the cartilage. So and it's very difficult to treat these keloids, so you have to make sure that you don't develop any infections, because the more infected one of the piercings becomes, it seems, the more likely to develop a scar there.
And even like, what kinds of questions should someone be asking, Lisa, about the needles and things that are being used?
Well, I think, first of all, it'd be nice to get a referral from someone else who had gone to a reputable place. You want to make sure that they are using sterile needles, specifically that they're using needles that have not been used on anyone else, that this is a first-time needle use. And in addition, you want to make sure that the technique that is used is sterile. You want to make sure that they wear gloves and that they use good wound care prophylactic techniques.
What about later on in life? Sometimes, you know, if someone's had a lot of piercings done or a lot of tattoos, how can you have tattooing removed?
Well, laser is the best way to have tattoos removed, but you have to keep in mind that you cannot tattoo a fresh laser. You have to wait at least 3 months, and it's best to decide that you really want to have a tattoo, because it can take anywhere from 6 to 12 treatments, and it can be fairly costly, certainly more expensive than having the tattoo applied. And you really should know what you're getting into. But usually the tattoo removal with laser is somewhat painful, and every month or so you can have the treatments. They take about a week or two to heal. You have to make sure you do not have any sun before you have your treatments, and you cannot tan in between treatments, otherwise you can get a brown discoloration. And some colors do not respond very well to a laser. For example, green is very difficult to remove.
And Daniel, what about things, if someone's going to a plastic surgeon, they're sitting with someone who's gone to medical school and has a degree, and they can say, you know what, I think maybe you're going too far, it's too much, you had enough surgery. But in the case of, over piercing, over tattooing, there's sort of no board here to stop someone, and, there is that fine line between self-mutilation.
I think that, as you mentioned, this can be an addiction. I think that it's an in thing at the moment, and some people get carried away. Some people really want to be covered in tattoos. They want to be pierced everywhere. They're making a very aggressive statement, and there's a fine line. Some people are really hurting themselves.
Further to Danny's point, I think that if you go to a reputable plastic surgeon or a dermatologist, that they will be able to see exactly what that person's needs are, and in fact refuse to do surgery or procedures on them based on the fact that they're not an appropriate candidate.
Yes, exactly, and that's, that doesn't exist, unfortunately, with tattooing or piercing. If a teen is considering a tattoo or a piercing and has their mind set on it, the best thing to do is help them source a reputable practitioner that has a track record of performing infection-free procedures.
The hottest show on television is back.
Are you kidding me?
This season is going to be different.
I'm not as innocent as I look.
Because only nice women are in the competition.
I smoke cigarettes, got a thing for tequila.
There won't be any cattiness or backstabbing.
I have a warning for all you girls. Don't mess with me.
Okay, we lied. 12 new sets of claws. America's Next Top Model. A new season begins June 8th after Matchmaker on Life Network.
Sorry to bother you. Do you know where the on-ramp is?
Introducing the new 2004 Lancers, loaded with standard features and still starting under 16 grand.
Can I help you with something?
Yeah, I'm here to skate.
You skate? Stuff.
Creme of our yogurts from Danone. A unique texture, rich, delectable,
I love you, babe.
Enhanced with a touch of real cream. Irresistible. La creme of our yogurts from Danone. You won't want the taste to end.
PharmaSave knows sometimes you just need a little nighttime comfort. We're here to support you with warming herbal tea, perfect sleep accessories, and soothing night creams. Because when it comes to your wellness, we care. One stop, one goal, to help you live well.
Live well with PharmaSave.
Okay, move it along, people. Move it along, move it along. Okay, sit down. Sit down. Quickly. Oh, you're good.
Our second topic today is winter itch. Dry skin is seen more often in the winter when cold air outside and heated air inside may cause a decrease in humidity. In worst cases, the skin can become scaly or discolored, prone to cracking and bleeding sores when left untreated. When the relative humidity inside drops below 60%, your skin begins to lose moisture, causing that dry, itchy, flaky skin that irritates so many during the winter months. And of course, you know, it's a catch-22 because sometimes, you know, people try to wash it away or even moisturize with perfumes and things, and that can make it worse, can't it, Daniel?
Absolutely. I think in our cold, dry climate, especially as one gets older, and with central heating, we get drier and drier and you get cracking. So one has to use a very good moisturizer, something that may be Vaseline-like, or the cosmetic companies make much more elegant moisturizers. One should take baths rather than showers and then moisturize right after the bath. And one shouldn't repeatedly bathe. So some people who work out have a shower in the morning and a shower in the evening, and this can really dry out the skin. The skin is a barrier and it loses its barrier function.
Now, what about excessive sun tanning in the summer? Would that contribute at all, Lisa, to, say, winter itch?
Well, I think that if you're coming at the end of the summer into the fall season and you do have some shedding, that would contribute. Another helpful hint is to put some oil in the bath. You want to get an oil that will mix with the water, such as alpha carry oil. That's often helpful for people.
And a humidifier is a good idea during the winter time. And I tell patients to wear soft cotton clothing, no wool, nothing that's itchy on their skin, and just to make sure that they keep their skin well moisturized. And unscented products usually are best.
Now, what about washing with soap? Is that sort of a no-no?
No, I think you have to wash with soap. There are some super fatted soaps that can be used, or body washes. And don't scrub, just, you know, just pat yourself dry just very gently and then apply your moisturizer. There are certain moisturizers that have various chemicals in them. For example, urea, which helps retain water in the skin, and some of the other acids, for example, the alpha hydroxy acids, they can help peel the dead skin so that your skin does feel and look better.
Now, what about diuretics? They have a tendency to contribute as well. So, you know, does someone ever come into your office and maybe not be forthcoming with some of the medications over the counter that they're taking, Lisa?
Well, in general, when someone comes to the office, you always do a complete history and physical. The history would include medications. I prefer that people actually bring their medications to me so I can actually see them. And also, it's important to ask about over-the-counter medications as well, because they can contribute to water loss in the skin.
Winter itch can be a persistent and bothersome problem for many. If you suffer from winter itch every season, it pays to see a dermatologist well in advance of the coming winter months to prepare a prevention method. Our next topic is laser resurfacing. Up to 70% of fine wrinkles can be vaporized with one treatment. Laser resurfacing is the fourth most common non-invasive cosmetic procedure in North America. 55% of facelift patients have laser resurfacing procedures performed as well. And Lisa, maybe you can just tell us the procedure, how it works.
Okay, in general, I'm just going to go back a little bit. Historically, what was used to be done was something called dermabrasion. And dermabrasion was basically using something like sandpaper to remove wrinkles. As time went on and lasers were improved, there's something called laser resurfacing that began. And that includes lasers such as the CO2 laser and now a newer laser such as the erbium laser. And what that does is it just vaporizes the top of the skin. The target is water, and by vaporizing the top of the skin, it causes heat to form underneath the skin in the dermis. That heat also helps to remodel collagen and decrease the appearance of wrinkles. The newer laser, called an erbium laser, is similar to the CO2 laser, but the advantage is that there is less downtime with that laser. In general, CO2 resurfacing, you're looking at about 3 to 4 weeks of downtime, and there's significant oozing and crusting associated with the procedure. In addition, the procedure has to be done under general anesthesia. With the newer laser, an erbium YAG laser, the procedure can be done while awake, and the downtime is much less, about a week.
So now what would be the difference, Martie, say, in taking Botox or Restylane and Perlane versus, you know, the YAG here?
Well, all of these procedures are complementary, and they all do different things. For example, the laser resurfacing, it helps with the texture and fine lines. Botox is injected into specific muscles to relax those muscles so they don't cause the frown lines or the crow's feet around the eyes. And then you can also have filler substances, and they help plump up the skin. So where you have, say, grooves, increases from the nose to the mouth, which is a very common area, they can be softened with fillers, and all of these procedures can be done.
So is there one that's better than another for certain candidates, Daniel?
I think that you look at the patient and you decide what they need, and it may depend on age and sun damage and how much wrinkling and where the wrinkles are. If there's a lot of sagging, somebody may need a facelift. If there's a lot of wrinkling, they may need to be laser resurfaced. There are some areas, as Dr. Gidon mentioned, that move, like the crow's feet, and you're going to resurface those areas. If you treat them before resurfacing with Botox, you may get a more long-lasting, better result with your resurfacing. So you have to tailor your treatment to, or mix and match your treatments to the patient.
And so how long, Lisa, for instance, would, say, resurfacing last? Is it 3 years, 5 years, 10?
Well, it depends on the depth, and generally looking about 3 to 5 years. Unfortunately, once you have the procedure, you continue to age, and we can't stop that. But I think, as Dr. Schachter and Dr. Gidon mentioned, the most important point is to have a comprehensive program to look at all aspects of the aging face.
Skin color is not necessarily a barrier to treatment, though skin thickness and texture may determine whether you are a good candidate for laser resurfacing. Often the procedure is done in conjunction with another cosmetic operation, such as a facelift or eyelid surgery.
Being a mother. The unforgettable beginning.
Painful, frightening experience.
He just shot out of me like poop, and she caught him like a football.
The ongoing effort.
Please don't bite Mommy's toe.
It's the little things.
I love you.
That make it all worthwhile.
Hello, Mom.
On Mother's Day weekend, experience 3 uniquely different and touching one-hour specials that are all about Mom. Starting May 8th on Life Network.
You can take a bowl of oatmeal anywhere. Oatmeal to-go bars, the nutrition of a bowl of instant Quaker oatmeal in a bar. Now you can take oatmeal anywhere. Introducing Oatmeal to-go oatmeal squares in delicious banana bread and brown sugar cinnamon.
Big cleanups on hard floors just got a lot easier thanks to the Floor Keeper from Dirt Devil. It's the all-in-one cleaner for all types of hard surfaces. Just vacuum, scrub with the Power Scour revolving brush, then squeegee the floor dry. For linoleum, tile, marble, and hardwood. Don't pay $200 or more when you can get heavy-duty cleaning power at an incredibly lightweight price. Hurry into Walmart today and pick up the Dirt Devil Floor Keeper. Nothing escapes the power of a Dirt Devil.
I'm a big kid, look what I can do. I can wear big kid pants too.
New Pull-Ups training pants are just like big kid underwear. They go off and on. And now come in Disney Pixar's Buzz Lightyear for boys and Disney Princess for girls.
Mommy, wow! I'm a big kid now.
One night, some lawyers snuck into your home and made you sign a contract dictating that you have to be a mature, sedan-driving adult. The bad news, there really is your signature on the contract. The good news, there's a loophole. No one said it has to be boring. It can be fun. It can be gorgeous. It can be fast. That's the loophole. Huh.
Our next topic is moles. On average, everyone has approximately 25 moles. Melanoma appears as a pre-existing mole that changes or as a new mole on previously unaffected clear skin. More than 80% of skin cancer deaths are from melanoma. And I think one of the things that we can identify ourselves is the ABCDEs of moles, Daniel, and you can tell us exactly what that means.
A is asymmetry, B is border, C is color variation, and E is eccentric or unusual. What we're looking at in a mole is whether it's very irregular. If it's nice and round and it's got even color, it's usually a benign or a nothing to worry about mole. If it's very irregular, it's got unusual colors, light and dark brown, maybe blue or black, white areas, pink areas, you may have to worry about it. If it's bumpy and unusual and frightening, sometimes that's something to worry about. And if it's larger than the pencil eraser, 6 millimeters, maybe you should worry.
Now, sun exposure as well can increase the chance of moles, Lisa.
That's correct. It's actually thought that as an embryo, we all develop the ability to have moles, and that's pre-configured before birth. But that with sunlight exposure, that basically brings out these moles. And I think the most important point to get across is that people should examine their skin once a month, looking for any new moles or change in moles. And that means a change in size, shape, color, or border. And if people are doing that once a month, then if something was to develop, then they'll catch it early.
Sometimes even though with pregnancy or birth control pills, the size and the color can change, Martie.
Of course it can, but you look for a regular change, not something unusual. As was said, the shape should remain the same, the color it will darken, but it should be a confluent pigmentation, not irregular. And we also know that the more moles that someone has, the greater their risk of melanoma. And of course the sun can trigger more moles to develop, especially in sun-exposed areas, so on the face, the upper extremities. So it's very important right from birth to protect from the sun.
Definitely, and even sometimes, you know, moles can appear in spots that we're not very aware of, so maybe have someone at home check your back, Lisa.
Absolutely, and don't forget your scalp, which people often forget, the palms and the soles of the feet.
That's a great point, because even with the palms of our hands, we often forget just to put sun protection on it, sunscreen. And the other thing too is we often, when we're eating, when we wipe our mouths, the upper lip is an area that we have a tendency not to recover too, Martie.
Well, it's important when you apply sunscreen to reapply. If you've been outdoors for a fair length of time, if you've been swimming or you have an activity where you're sweating, you always should reapply your sunscreen.
Daniel?
I like to remind people to use sunscreen containing lip balm, and there are some that have an SPF of 30 or even higher, and to use this on their lips and repeatedly use it, and also maybe even around the eyes, because when you put sunscreen around your eyes, it may run in and burn. You should also remember your ears, because your ears often stick out from a baseball hat and they can easily burn. And certainly if you have young children, you should in addition cover them. They should wear a hat with a brim, and the more coverage the better.
And don't forget sunglasses.
Mm-hmm. There are also multiple companies now that actually make sun protective clothing, which is good for children who don't like to wear sunscreen.
Often from Australia.
And you should watch when you're having your sun exposure. Try and avoid the sun between 10 and 4. Just avoid the times when you're outdoors.
As a reminder to our viewers, a normal mole is solid tan, brown, dark brown, or flesh-colored. Its edges are well defined. It's usually smaller than 5 millimeters, that's 1/4 of an inch in diameter, and has a round or oval shape. It should be flat or dome-like.
Introducing the Home Gardener Gutter Blaster. Its water pressure trigger and changeable nozzle let you do anything from watering hanging plants to full-scale jet blasting. Plus it extends, so you can clean your eaves with ease. You can only get the Gutter Blaster at your local home hardware or home building center. And like every quality home gardener tool, it's fully guaranteed. Get it today for only $19.97. Home Hardware. Hell is close to home.
So you want your dear old Uncle Angus to lend you $200 till next payday. Well, let me tell you, in my day, we'd break our backs, swept chimneys, gutted fish, your father and I smashed rocks, milk goat 25 hours a day, pinched every penny, 'cause the world judges a man by the size of his sporran.
Need cash before payday? It's cheaper than you think. Check out moneymart.ca.
Don't spend it on one shop.
I see you're drinking Diet Pepsi. Is there anything else youthful you'd like to experience?
Yeah. I'd like my old van back.
Everybody's working for the weekend. Everybody.
On second thought, I'll stick with my Diet Pepsi.
Taste the one that's forever young. Diet Pepsi. Confusion. Utter confusion. Is that my mom washing with Johnson's? It can't be. It is. It's new Johnson Soft Wash Body Wash for grown-ups. It's got 1/3 baby lotion. So now you can wash baby softness into your skin, too. Got that? Got it. New Johnson Soft Wash Body Wash. Now you can have baby soft skin, too.
Our final topic is teenage acne. Approximately 85% of acne develops during adolescence. 3 out of 4 teenagers have acne to some extent, probably caused by hormonal changes that stimulate the sebaceous oil-producing skin glands. Acne usually hits girls between the ages of 10 to 17 and boys a bit later at the ages of 14 to 19. And I think, Lisa, one of the first things we can address is some of the medical myths that chocolate bars cause acne.
There are a number of them. One is chocolate bars cause acne. I tell my patients that in general, what you take in reflects in your skin. If all your diet consists of is chocolate bars, then your skin will reflect that. However, if you have a chocolate bar once a week, then that is not causing your acne. Another myth is that people with acne don't wash enough, they're not clean enough. That is also a myth. The important thing to note is that there are multiple treatments available for people with acne and that you don't have to suffer with acne.
And even greasy foods. I mean, you know, there's that concern that if you're eating some hamburgers, Marty, that you're actually going to be producing pimples or acne. And the truth is you know, that's not the case. Now, if you're flipping the burgers and cooking, maybe the grease coming off of the grill might contribute.
That's right. Studies in the past have not been able to prove that foods can cause acne. However, I often will have patients who come in and they know what will aggravate them, and they know if they have too much fatty foods or sweets or chocolate that sometimes they will break out, and I just tell them moderation and try to avoid foods that you think might be causing problems for you.
Daniel, another thing I think we have to address, especially with teenagers, is popping pimples will make them go away faster.
I don't think that popping pimples makes them go away faster, and in fact it produces scarring, and I think that the resulting mark often lasts longer. I think we have to tell the patient not to pop their pimples, and also perhaps the parent not to pop their pimples.
Right, and also to have the parent maybe, you know, tell the teenager as well over and over again that it's a myth. Popping isn't going to help.
Often patients think that their skin is dirty and that's why they're developing acne, so they scrub a lot. And it's very important to just use a very mild cleanser and to not scrub. You have to be very gentle with your face.
Many teenagers with acne have a negative self-image, which can lead to withdrawal from friends and activities, inappropriate behavior, and poor academic performance. That's why making sure your teen sees a dermatologist is important. Thanks to all the doctors who appeared on today's program for providing their invaluable advice and insight into the problems facing medicine today. If you have any questions or concerns about these or any other medical topics, consult your doctor. That's it for today. I'm Deborah Kelly, and we'll see you next time on Diagnosis MD.
For cash quizzes and info on managing your money, visit lifenetwork.ca.